So let's continue the discussion with Lyme-induced immune deficiency. You pretty much become, a sitting duck for co-infections and toxins just because your immune system is suppressed and not working 100%. Bottom line, if you're still sick, right, when you have patients or when you are a patient yourself and you're still sick, nothing's helping, it's important to change your plan. Start thinking. My spiritual guru once explained to me that when you hit rock bottom, that is when the mind opens. That is when, you start exploring avenues and options that you never would have explored before. So sometimes hitting rock bottom is a way that this universe is trying to communicate with you, trying to make you more open-minded, that, look at other things as well. So most Lyme treatments will start by treating the infections, As soon as a patient sees the lab results, oh my God, I have infections, I need antibiotics. That is the typical reaction, right? But maybe that's not how it should be. Maybe that's, like we say, that's putting the cart before the horse. As we talked before, just remember, health is not just the absence of disease. Health means a whole lot more. Health means that you are thriving, not just surviving. An important thing that I like to teach the other physicians when I'm doing physician training is that you cannot kill your way to health. You cannot kill the bacteria, kill the infection, kill this and kill that, and still expect to feel healthy. There needs to be a gentle approach. There needs to be respect for the body, and we need to allow the body to help with the treatment process. You cannot just dictate to the body what you're going to do about the infections, because it's not going to work. People are going to keep relapsing. So consider the effects of the microbial toxins on the body. Okay, there is metabolic waste, there is biofilm, there is changes in almost every cell membrane permeability. The pH in your body lowers, enzymes are inhibited, there is a neurotransmitter imbalance, there is molecular mimicry and autoimmunity happens. There is hypercoagulation or thickening of blood, and there's a few other things which will happen as we go along. Excuse me a second. Okay. All of the treatment protocols needs to consider toxins, heavy metals, amalgams, other chemicals like anesthesia you may have been exposed to. Any nutritional deficiencies and biochemical imbalances have to be explored. I do a full nutritional analysis, intracellular nutrition and extracellular nutrition, to see what is missing. Often patients will come up with a lot of vitamin and mineral deficiencies. And, and of course, we also do a full endocrine panel to look at any hormonal deficiencies that may have happened. Any kind of structural problems, this applies to adults as well as children. Sometimes you will see craniosacral issues. Sometimes you will see, jaw imbalances. Sometimes you will see tongue tie issues in children, which can exacerbate or make worse any kind of postural and neuropathy issues that happen with borreliosis. Energy medicine is very important, right? Bioenergetic issues in the body. If you have any old scars, if you have any tonsils that are giving you problems, and a good acupuncturist or a good Eastern medicine practitioner, Ayurvedic, will be able to evaluate the energy channels in your body. Look at how your chi is behaving, your chi or your prana or your vital force. A good bioenergetic evaluation is a great addition to this entire protocol of dealing with Lyme disease. Look at any kind of food allergies. We also look at geopathic stress. Geopathic stress would be, where you live. Indian culture calls it vastu, to see, the location of your house, the location of your property, your business. I'm sure you guys are familiar with feng shui. Have you heard about feng shui? Yeah, similar to the Indian Vastu. Electromagnetic frequencies, how much electrosmog you have in your house or in your apartment that you're living in school, that's important. And as I mentioned before, unresolved emotional conflicts. When there is Lyme disease, there's not just Lyme disease. There are 3 important components of Lyme and co-infections that have to be addressed. One has to look at, of course, the actual presence of the spirochete and the other infections. So we are looking at the actual bacteria. Then we have to look at the effects that the toxins are producing. We have to look at the microbial exotoxins and the microbial endotoxins and see what effects they are producing on various organs in the body. Thirdly, one needs to look at the immune reactions that are provoked by the toxins and the germs, right? So this is where the individuality comes in. I always talk about bio-individuality. I don't have any 2 patients that are on the same protocol. Everybody is different. I do a lot of genetics. We look at everybody's individual immune system, everybody's individual immune reactions to see how the body is reacting. I do about 3 different types of genetic testing. And then we try to correlate the symptoms with the patient, and we try to problem solve that way. There might be patients who are not getting well, and we need to find out why. So some of the immune reactions we see would be energy, right, where there is no immune reaction. That I think I'm really healthy because I never get fevers. That's that reaction. Then we see molecular mimicry, which would be a pandas or PANS type of reaction. Some other autoimmune illnesses fall into this place would be IBS, inflammatory bowel disease, Crohn's, colitis, hypercoagulation, false elevations in blood pressure. It's very interesting. What I'll see is instead of having your typical blood pressure, high blood pressure presentation, clinical presentation of having high systolic and also having a higher heart rate, you will see very normal heart rate or even athletic level heart rates, but you will see high systolic blood pressure, normal diastolic. So that gives you a clue that there might be some hypercoagulation issues going on, not really a pathogenic high blood pressure issues. Then there's all sorts of weird allergies that happen. There is a specific allergy that can develop to meat when you have Lyme disease. And because the spirochete loves the gut, there can be sort of leaky gut issues as well. And you might find yourself being sensitive to food and other chemicals that you were not sensitive to before. And autoimmunity, it can manifest as MS or Parkinson's and lupus, Crohn's, colitis. Okay. What is the order of treatment? As you can see, I don't really treat Borrelia first. First, we look at worms, then we look at strep, then next would be the protozoa or Babesia species, then I look at the herpes family, then we do the yeast, the mycoplasmas, and finally we come to the tick-borne infections. Now, this is your typical chronic patient. If there is an acute patient, then of course, it has to be treated a little bit differently, because an acute patient will want to treat the Lyme disease first. And you have to respect the patient's wishes. But when I see a chronic patient with lots of disseminated multi-system illness, that is when I talk to them and I explain, I'm like, if we don't go in this order, it's just not going to work. We have to go with what is more immune suppressing and then slowly come down from there. I'm not going to talk each and every slide about biofilm. I just have it there for your information. But who has heard of biofilms? Oh, great. Okay, a few of you. Okay, good. Yep. And do you guys treat the biofilm? Are you addressing it? What are you doing, sir? What are you doing to address the biofilm? Okay. Yes. So debriding the biofilm, correct. So a few things that are important to know about biofilms, that they have a negative charge, and they are held together, biofilms are held together by molecules with a positive charge. So negative, positive, nice strong bond. It's very difficult for regular medication to be able to debride the biofilm. There's usually several layers to a biofilm, right? There's heavy metals incorporated in there. Because there's biofilm, the good microbiome, the good bacteria cannot penetrate, cannot thrive, and also nutrients are not absorbed. If you have biofilm in the gut, then obviously, it becomes difficult to absorb nutrients. It's important to look, this is actually Dr. Usman and Dr. Klinghart's work that I've studied from, and it's important to look at vitamin A. And as I mentioned before, look at all nutritional deficiencies pretty much. Okay, so we have multiple microbes that have been isolated from biofilms. There's bacteria, mycoplasma, viruses, yeast. And keep in mind that biofilms are a sheltered environment from the immune system. The immune system doesn't penetrate the biofilms. Okay. Anytime one does biofilm debridement, you need to be careful and monitor the ammonia levels. Right? Not everybody can tolerate the debridement enzymes. Is that the translator I'm hearing? Right? Yeah. Okay. This one? Thank you. Okay. It is important to work with an experienced practitioner so you're not releasing the contents of the biofilm too quickly. Because when you have yeast, heavy metals, different kinds of bacteria, viruses, you don't want to release them all at once. Or, I don't really believe in getting a heavy-duty Herxheimer reaction. Some doctors believe that, okay, we are getting a reaction from the patient, they are herxing. That means that we are killing the Borrelia. That's really not necessary. I try to minimize the Herxheimer reaction in my patients by giving by giving a lot of supportive medications. We do a lot of anti-inflammatory supplements to make sure that the patient is comfortable. So with biofilms, with everything pretty much with Lyme disease, you start slow.